We need your help. We're trying to raise money to buy a property for Duduza House, a home where people can learn more about ways to both support themselves and the people around them. It'll also be a space where we can work together and learn more about mental health and well-being in Swaziland.
Swaziland is a small, peaceful kingdom in southern Africa in which the majority of people live in tight-knit communities, supporting themselves through subsistence farming and small businesses. A population of around 1 million people face high rates of HIV, widespread poverty, the exploitation of women and children, high rates of domestic violence and abuse, and problems with alcohol and substance abuse. This leads to many people experiencing depression and anxiety, and some even experiencing suicidal thoughts. There is a need for improved awareness and support for mental health in Swaziland in culturally appropriate ways. A group of local psychologists have come together with a vision to create a space to provide holistic mental health care. Pernilla Hansen is a psychologist born and raised in Swaziland. She is the founder of Duduza.
So in late 2016, we started an organization called Duduza. Duduza means comfort. And that's essentially what we want to do with Duduza, is we want to provide comfort and support. Essentially, we're looking at supporting people so that they can be healthy and live well and function well. Our primary focus is on mental health and psychosocial support, but we hope to collaborate and work with other health professionals, doctors, physiotherapists, anyone else who can help promote health.
We have seen that Swaziland faces many different challenges around mental health. Sifiso Shabangu is a clinical psychologist working at the Swaziland Psychiatric Hospital.
It's often not the health part that's even defined, it's the illness part. It's often understood in terms of mental illness. Like you are psychotic, you are aggressive, you are rowdy, you need to be taken to the psychiatric hospital.
In most cases, Swazis think whenever you've got a mental health problem, you are bewitched. And in that case, it makes it very hard for somebody who's got a mental health problem to get help.
They're feeling what they are feeling and it's there. But everything around them says, do not acknowledge it. If you are feeling a mild form of depression, or you are feeling sad and down, or you just lost a loved one, you can't go there. That's only for people who are psychotic, and that's the false impression that's out there.
Dividendo, it's whereby something is happening in the family and we're keeping it a secret. We're keeping it among ourselves. It can't be anything. It goes up to rape and all the stuff. So others tend to keep it a secret, so they call it dividendo.
So-and-so is going to see me. My uncle's nephew works there, or my sister's other friend works there, and they know me, so they don't come. Awareness is still very, very necessary.
It's difficult to help that person because he sometimes doesn't follow the medication properly. Maybe if you try to help you become scared to help the person because it's beating everyone. It's better if it's kept in the Zakhele clinic.
We are a country that has a skills shortage. At our hospital, the psychiatric hospital, we have 2 clinical psychologists, and it's a government facility. We have 1 psychiatrist, and that psychiatrist caters for the entire country. But at each hospital, government hospital, there are some services, like you have a psychiatric unit in the hospital. So the patients come there and they're seen by nurses, they do what they can. And if they can afford to come down to our hospital, then they come down. If they can't, then that's probably the end of the support they can get in terms of psychological services.
What we want to do at Duduza is 3 things. We want to provide direct services of support so that individuals or families or groups can come and get support at Duduza. We also want to build capacity of individuals so that they can take better care of themselves, but also build capacity of people who are helping others.
One of the fears is that they will seek the services and there'll be no one qualified to provide those services.
We'd also like to set up an apprenticeship program so that people who, for example, have bachelor training in psychology could come and get practical experience in providing support to other people. The third thing we want to do is build a cadre of trained researchers so that we can do research on mental health issues in Swaziland and just help inform our practice better.
You know, we have our own context, our own people, and we need to find out what's going on with our own people in terms of empirical research, and we are not doing that at all.
What we hope with Duduza by building capacity is that we can decentralize it and more people around the country can provide support and services that are not available at the moment.
To make our Duduza dream a reality, our biggest challenge is that we don't have a place to work from. Having a place would give us a venue where people can come and receive counselling, can attend workshops and training, and where we can conduct research. Without a central place to work from, Duduza cannot grow to meet the needs of the community. Your support will help us invest in this space and vastly improve the lives of many people in Swaziland. Visit our Duduza crowdfunding page on Indiegogo to get involved by donating and spreading the word. Duduza is something close to our hearts. Thank you for believing in Duduza and our dream.